The antiseptic smell of Memorial Hospital's pediatric wing filled the air as 9-year-old Emma Rodriguez sat quietly in the corner of the consultation room, her small notebook open on her lap. The morning light filtered through the hospital windows, casting long shadows across the polished floors where some of the region's most respected medical professionals conducted their daily rounds. Emma's presence in such a clinical environment seemed as unusual as finding a wildflower growing in concrete. Dr. Michael Harrison observed the small figure from his position near the examination table. His distinguished face showed the kind of professional skepticism that came from 25 years of pediatric medicine. At 48, Harrison commanded respect through decades of clinical experience that had taken him from medical school to department chief, building a reputation for diagnostic excellence through methodical analysis and evidence-based treatment protocols. The sight of a child taking detailed notes during medical consultations challenged his fundamental assumptions about patient care boundaries. Before we jump back in, tell us where you're tuning in from in the comments below. If this story touches your heart, make sure you hit that subscribe button right now. Tomorrow, I've saved something absolutely incredible for you that will completely blow your mind. Dr. Martinez, Harrison called to his resident with obvious concern in his voice. Please explain to me why we have what appears to be a 9-year-old girl documenting medical procedures in my consultation room. Dr. Sofia Martinez approached with the careful diplomacy that came from managing Harrison's exacting standards while maintaining patient care effectiveness. At 32, Martinez had earned her position through exceptional performance in pediatric emergency medicine, developing skills that made her valuable for handling complex cases, requiring both clinical expertise and family communication sensitivity. Sir, Martinez replied with professional composure. Emma Rodriguez is here with proper authorization from hospital administration. Her mother is Dr. Carmen Rodriguez, currently serving with Doctors Without Borders. The family requested access to educational observations during her deployment. Harrison studied the authorization paperwork with growing irritation about administrative decisions that seemed to prioritize family accommodation over clinical environment integrity. The documents appeared legitimate, but the idea of allowing civilian dependents to observe specialized medical procedures designed for professional training struck him as fundamentally inappropriate. Dr. Martinez, this is a teaching hospital, not a daycare center, Harrison declared with authority that made nearby medical staff pause their activities. That little girl's notebook doesn't belong in the same room where we train future physicians for life-saving procedures. Emma Rodriguez had been conducting her own assessment of the medical environment while the adults discussed her presence and qualifications. Her small hands moved systematically through her notebook, reviewing anatomical diagrams and symptom patterns with attention that suggested familiarity far beyond casual medical interest. The journal she carried contained detailed observations and medical terminology that indicated serious study rather than childhood curiosity. Dr. Harrison, a quiet voice said from behind him. Emma had approached with the respectful bearing that medical families learned early, recognizing professional authority while maintaining personal dignity under challenging circumstances. My notebook may be smaller than your medical charts, but my mother taught me that accurate diagnosis comes from careful observation, not equipment size. Harrison turned toward Emma with the kind of patronizing attention that adults typically reserve for children who said amusing things during serious conversations. The girl's composed demeanor impressed him despite his skepticism about her claimed medical knowledge. But he remained convinced that childhood enthusiasm couldn't substitute for medical training and clinical experience. Little lady, Harrison said with elaborate patience, I'm sure your mommy taught you some basic health information, but this hospital is designed for professionals who need to make decisions that save lives in critical situations. Your notebook is very nice, but it's not appropriate for the kind of work we do here. Nurse Patricia Wells had been observing this exchange while conducting equipment preparation for the day's scheduled procedures. At 44, Wells possessed a reputation for developing struggling medical students into competent practitioners through patient guidance and systematic skill building. Her experience with diverse learning approaches had taught her to recognize genuine understanding regardless of its source or initial presentation. Dr. Harrison Wells interjected diplomatically. Emma's observations appear to be more sophisticated than they initially look. That notebook contains medical terminology and diagnostic patterns that rival our student documentation. Harrison examined Emma's notebook more carefully, noting clinical observations that he had initially dismissed due to the writer's age. The journal's content quality and systematic approach suggested serious engagement with medical concepts rather than recreational reading designed for casual entertainment or basic education. Impressive documentation, Harrison acknowledged grudgingly. But advanced vocabulary doesn't make a child capable of clinical reasoning. Medical diagnosis requires analytical thinking, pattern recognition, and experience that can't be developed through textbook study alone. Emma's response came with calm confidence that surprised everyone present, who had expected either intimidation or childish defensiveness when confronted by medical authority and institutional skepticism about her claimed capabilities. Dr. Harrison, would you be willing to observe my analysis of the current case presentation? Emma asked with straightforward sincerity. I understand your concerns about hospital protocols, but I believe diagnostic reasoning speaks louder than assumptions about age or formal training. The challenge was delivered with such mature professionalism that Harrison found himself caught between institutional protocol and curiosity about what this unusual situation might reveal about civilian medical education and natural analytical ability in unexpected contexts. Miss Rodriguez, Harrison replied after several moments of consideration. I suppose reviewing your observations wouldn't hurt, provided we maintain proper patient confidentiality. But I want you to understand that this is educational courtesy, not validation of your claimed diagnostic abilities. Dr. Jennifer Kim had been preparing case files when she overheard the discussion about Emma's proposed medical analysis. As chief resident, Kim possessed responsibility for ensuring that all educational activities followed established medical ethics while maintaining flexibility necessary to accommodate unusual learning opportunities. Dr. Harrison, Kim said respectfully, if we're conducting an evaluation, we should establish clear parameters for medical reasoning assessment. What case complexity would constitute meaningful demonstration of diagnostic thinking? Harrison considered the question while studying Emma's detailed notebook and obvious determination to prove her capabilities under professional scrutiny. His expectation remained that brief review would expose the limitations of civilian medical education while providing learning value about the differences between theoretical knowledge and clinical reasoning requirements. Current admission case, Harrison decided. 12-year-old patient with presenting symptoms that have puzzled our diagnostic team for 3 days. If Ms. Rodriguez can contribute meaningful insights, I'll acknowledge that her educational background has some clinical value. Emma nodded acceptance of these parameters while conducting her own systematic review of available case information that would affect diagnostic accuracy. Her methodical approach to evaluating presenting symptoms, laboratory results, and physical examination findings impressed the medical professionals present who recognized behaviors that reflected serious analytical training rather than childhood curiosity. Dr. Harrison, Emma said with growing confidence, I accept your challenge. But I'd like to request permission to review the complete case file, including test results that might have been overlooked or misinterpreted. The mention of overlooked findings drew skeptical glances from medical personnel who understood the complexity of differential diagnosis under challenging clinical conditions. Harrison's expression showed amusement at what he assumed was childish overconfidence about abilities that hadn't been demonstrated under any circumstances. Overlooked findings, Harrison repeated with obvious doubt. Miss Rodriguez. Complex medical cases involve multiple specialties and diagnostic technologies that challenge experienced physicians. I think we should focus on basic symptom recognition. Before discussing advanced interpretation techniques, Dr. Sarah Chen had been listening to this exchange while reviewing laboratory results for cases that had challenged even experienced specialists' diagnostic capabilities. Chen's specialized knowledge of rare pediatric conditions made her valuable for evaluating claims about diagnostic insights that exceeded standard clinical reasoning requirements. Sir, Chen said carefully, the current case involves unusual symptom patterns that have required consultation with multiple departments. If Ms. Rodriguez wants to demonstrate analytical reasoning, the case file contains sufficient complexity for meaningful evaluation. Harrison's laughter echoed across the hospital corridor as he processed Chen's suggestion that a 9-year-old girl might provide insights into cases that had challenged pediatric specialists under optimal diagnostic conditions. The idea seemed so improbable that he found himself wondering whether this entire situation was some elaborate educational exercise. Dr. Chen, Harrison said with theatrical amusement, I think Ms. Rodriguez should focus on proving she can identify basic symptoms before we start discussing breakthrough diagnostic revelations. Emma's calm response to Harrison's mockery demonstrated emotional regulation that impressed Dr. Rachel Torres, a child psychologist who had been documenting stress responses and cognitive development patterns in medical families. The girl's composure under professional ridicule suggested intellectual maturity that exceeded her chronological age. Dr. Harrison, Emma said with respectful persistence, my mother served in emergency medicine before her current humanitarian assignment. She taught me that complex diagnosis isn't about miraculous insights, it's about systematic analysis, pattern recognition, and comprehensive evaluation of available evidence. The technical sophistication of Emma's response drew attention from medical professionals who recognized that her knowledge exceeded casual exposure to medical terminology. Dr. Martinez found herself reconsidering initial assumptions about civilian medical education and the potential value of observing Emma's actual analytical process rather than dismissing her claims without evidence. Harrison studied Emma's face, seeing in her expression the same focused determination that he had observed in exceptional medical students who possessed natural analytical ability combined with systematic education. Despite his skepticism about her age and experience, something in her bearing suggested competence that deserved evaluation rather than dismissal. Miss Rodriguez, Harrison said with authority that made his words carry institutional weight. If you want to demonstrate advanced diagnostic reasoning, you'll need to prove basic clinical observation first. Standard case analysis with proper medical documentation. Succeed there, and we'll discuss more complex diagnostic challenges. As Emma moved toward the patient chart with movements that reflected practiced familiarity with medical documentation procedures, Harrison positioned himself where he could observe both her analytical approach and diagnostic conclusions. His expectation remained that reality would quickly deflate childish pretensions, while providing educational value about the differences between theoretical knowledge and practical clinical reasoning. The morning hospital routine had settled into its normal rhythm, creating ideal conditions for focused analysis that would eliminate environmental distractions for poor performance evaluation. What happened next would determine whether Emma Rodriguez's claimed medical insights represented genuine analytical ability or childhood imagination that would be exposed by the unforgiving reality of clinical diagnosis under professional scrutiny. The sound of pages turning in the case file seemed to echo through the consultation room with unusual significance, as though the medical charts themselves understood the importance of the evaluation about to unfold. In a few moments, Harrison's confident assumptions about civilian limitations would be challenged by analytical reasoning that would exceed even his extensive experience with exceptional medical talent. The silence that descended over the consultation room carried the weight of institutional skepticism as Emma Rodriguez opened the complex case file that had challenged Memorial Hospital's pediatric team for 3 consecutive days. Through the detailed medical charts, laboratory results, and diagnostic imaging reports, a pattern emerged that seemed to dance just beyond the reach of conventional medical reasoning. The patient was 12-year-old Marcus Thompson, admitted, with symptoms that defied standard diagnostic protocols. His presentation included intermittent fever spikes, unexplained joint pain, unusual skin manifestations, and neurological symptoms that appeared and disappeared without predictable patterns. Multiple specialists had evaluated Marcus without reaching definitive conclusions about his underlying condition. "Take your time, Miss Rodriguez," Dr. Kim said quietly, from her position as supervising resident. "Remember, we're evaluating analytical process as much as diagnostic accuracy." Emma's systematic approach had already settled into the methodical pattern her mother had taught her during countless evening study sessions in their home medical library. The comprehensive review process that Dr. Carmen Rodriguez had learned during emergency medicine residency and passed down to her daughter like a family tradition of clinical excellence. Emma began her analysis by creating a symptom timeline that organized Marcus's presenting complaints into chronological patterns that revealed relationships invisible to casual observation. Her small handwriting filled pages with detailed correlations between environmental factors, medication responses, and physiological changes that painted a comprehensive picture of disease progression. The first breakthrough came when Emma noticed temporal relationships between Marcus's symptom flares and specific triggers that previous evaluations had dismissed as coincidental. Her mother's training in pattern recognition had taught Emma to look beyond obvious presentations toward underlying systemic connections that might explain complex clinical pictures. "Dr. Harrison," Emma said with growing confidence, "I believe Marcus's symptoms represent autoimmune dysfunction, triggered by environmental sensitivity rather than infectious disease or primary neurological disorder." The statement created ripples of interest among medical professionals who had focused their diagnostic efforts on more conventional explanations for Marcus's unusual presentation. Dr. Martinez found herself leaning forward to examine Emma's analytical documentation with genuine professional curiosity. "Environmental sensitivity," Harrison repeated slowly, his skepticism beginning to crack as he processed Emma's systematic reasoning. "Miss Rodriguez, autoimmune conditions in children require extensive laboratory confirmation and specialist evaluation. What specific evidence supports this diagnostic hypothesis?" Emma's response demonstrated clinical reasoning that impressed everyone present who possessed sufficient medical background to evaluate its accuracy and sophistication. Her analysis connected seemingly unrelated symptoms through pathophysiological mechanisms that revealed comprehensive understanding of disease processes. "Dr. Harrison, Marcus's laboratory results show elevated inflammatory markers consistent with autoimmune activity, but the pattern suggests environmental triggers rather than primary autoimmune disease," Emma explained with systematic precision. The temporal correlation between symptom onset and exposure history indicates hypersensitivity reactions affecting multiple organ systems. The technical accuracy of her diagnostic reasoning drew sharp attention from medical professionals who recognized that Emma's analysis exceeded standard differential diagnosis protocols. Dr. Chen found herself reviewing Marcus's case file with renewed interest, searching for evidence that might support Emma's unconventional diagnostic approach. "Miss Rodriguez," Chen said carefully, examining laboratory data that had puzzled multiple specialists, "your environmental theory is interesting, but we've tested for standard allergens without significant findings. What specific triggers do you suspect might explain Marcus's complex presentation?" Emma walked to the whiteboard with obvious eagerness to demonstrate analytical methods that her mother had taught her for solving complex diagnostic puzzles. the systematic approach to differential diagnosis that separated exceptional clinicians. From competent practitioners through comprehensive evaluation and creative reasoning. Dr. Chen, standard allergy testing focuses on common environmental allergens. But Marcus's symptoms suggest sensitivity to chemical compounds that wouldn't appear on routine panels. Emma replied with mature understanding. His symptom pattern correlates with exposure to synthetic materials and processed foods containing specific preservatives and artificial additives. The sophistication of Emma's environmental analysis impressed Dr. Torres, who had been documenting the psychological aspects of chronic illness in pediatric patients. The girl's systematic approach to identifying obscure triggers suggested analytical capabilities that challenged traditional assumptions about diagnostic reasoning development. As Emma outlined her comprehensive diagnostic theory on the whiteboard, connecting Marcus's symptoms through environmental pathways that previous evaluations had overlooked, the assembled medical professionals found themselves confronting analytical reasoning that exceeded their own diagnostic conclusions. Chemical sensitivity syndrome, Emma announced with confidence, that came from systematic analysis rather than guesswork. Marcus's immune system is reacting to synthetic compounds in his environment, creating inflammatory responses that affect neurological, dermatological, and musculoskeletal systems simultaneously. The diagnostic revelation created immediate discussion among medical staff who recognized the potential validity of Emma's environmental approach while questioning why experienced specialists had missed such connections during extensive previous evaluations. Dr. Harrison stared at the whiteboard analysis with an expression that suggested someone watching their diagnostic assumptions challenged by reasoning that exceeded institutional medical training. Emma's systematic correlation of symptoms with environmental factors revealed patterns that had remained invisible to conventional medical evaluation. Outstanding analytical work, Ms. Rodriguez, Dr. Kim said with genuine professional admiration. Your environmental sensitivity hypothesis provides explanatory power for symptoms that have puzzled our diagnostic team significantly. Emma lifted her head from the case documentation with satisfaction that came from applying systematic reasoning under challenging conditions while demonstrating respect for medical expertise that had provided this learning opportunity. Thank you, Dr. Kim. Emma replied with mature appreciation. My mother always taught me that exceptional diagnosis requires looking beyond obvious explanations toward underlying connections that reveal true disease processes. However, Emma's diagnostic triumph was interrupted by urgent activity in the hospital corridor as medical personnel responded to emergency conditions that required immediate attention. The sound of rapid footsteps and urgent communication indicated patient crisis situations that demanded professional medical intervention. Code Blue, Room 314, announced the hospital intercom system. Code Blue, Room 314. Dr. Harrison's expression shifted immediately to emergency response mode as he recognized the room number, corresponding to another pediatric patient whose condition had been stable until this sudden crisis. The announcement meant cardiac or respiratory emergency requiring immediate resuscitation efforts. Dr. Martinez, Dr. Kim, emergency response. Harrison commanded with authority that sent medical personnel into coordinated action. Ms. Rodriguez, please remain here while we handle this medical emergency. As medical staff rushed toward room 314, Emma found herself alone with Marcus Thompson's case file and her own analytical conclusions about environmental sensitivity syndrome. Her systematic diagnostic work had provided breakthrough insights, but the current emergency represented a different challenge that required immediate medical intervention. Through the consultation room windows, Emma could observe increased activity in the hospital corridor as additional medical personnel responded to the emergency situation. The urgency of their movements suggested serious complications that might threaten patient survival without immediate professional intervention. Emma's medical education had included Emergency response training that her mother considered essential. Knowledge for anyone pursuing medical careers. Dr. Carmen Rodriguez had taught Emma to recognize crisis situations and understand appropriate response protocols even when direct intervention wasn't possible. The emergency in room 314 continued for nearly 20 minutes before medical personnel began returning to normal activity. Patterns. Dr. Harrison's expression showed professional concern mixed with frustration as he rejoined Emma in the consultation room. "Miss Rodriguez, I apologize for the interruption," Harrison said, with obvious stress. "We have another pediatric patient experiencing complications that our medical team cannot adequately explain or treat effectively." Emma studied Harrison's face, recognizing the professional frustration that her mother had described when medical knowledge reached its limitations. In critical situations, the expression suggested patient conditions that exceeded conventional treatment capabilities. "Dr. Harrison, would you be willing to describe the emergency situation?" Emma asked with genuine medical curiosity. "My mother taught me that complex cases often share underlying patterns that might not be immediately obvious to individual evaluations." Harrison's initial impulse was to dismiss Emma's offer as inappropriate civilian involvement in serious medical emergencies. However, her demonstrated analytical capabilities with Marcus Thompson's case had earned respect that made her suggestion worthy of consideration rather than automatic rejection. "Miss Rodriguez, the patient in room 314, is 7-year-old Jessica Martinez." No relation to Dr. Martinez, Harrison explained with professional composure despite obvious concern. "She's experiencing severe allergic reactions that don't respond to standard treatment protocols. Multiple specialists have evaluated her condition without identifying effective interventions." The description of Jessica's treatment, resistant allergic reactions, immediately captured Emma's attention as potentially related to environmental sensitivity patterns she had identified in Marcus Thompson's case. Her mother's training had emphasized recognizing connections between seemingly unrelated patient presentations. Dr. Harrison, Jessica's allergic reactions might represent the same environmental sensitivity syndrome affecting Marcus Thompson. Emma suggested with systematic reasoning. Chemical compound sensitivity can manifest differently in individual patients, while sharing underlying pathophysiological mechanisms. The possibility that two pediatric patients might share related environmental conditions drew immediate interest from medical personnel who recognized the potential diagnostic significance of identifying common trigger factors or treatment approaches. Environmental connection, Harrison repeated thoughtfully, his skepticism now replaced by genuine clinical interest. "Miss Rodriguez, if Jessica and Marcus share similar sensitivity patterns, your analytical approach might provide treatment insights that conventional allergy management has missed." Emma's excitement about potential diagnostic connections was tempered by recognition that Jessica's emergency situation required immediate intervention rather than extended analytical evaluation. Her mother's emergency medicine background had taught Emma to prioritize patient stability over diagnostic curiosity. "Dr. Harrison, immediate treatment for Jessica should focus on eliminating environmental triggers while supporting her immune system recovery," Emma explained with clinical urgency. Chemical sensitivity reactions respond better to environmental control than pharmaceutical interventions alone. The treatment recommendation represented analytical reasoning that connected Emma's diagnostic insights with practical medical intervention strategies. Her systematic approach to environmental medicine offered therapeutic options that conventional allergy management might have overlooked. As medical personnel implemented Emma's treatment suggestions for Jessica Martinez, removing synthetic materials from her hospital room and switching to natural alternatives for medical supplies, her allergic reactions began showing improvement. That validated Emma's environmental sensitivity hypothesis. Remarkable recovery, Dr. Wells announced after monitoring Jessica's vital signs during environmental modification treatment. Her inflammatory responses are decreasing significantly with trigger elimination and supportive care. The successful treatment of Jessica's emergency situation using Emma's environmental approach has provided concrete validation of diagnostic reasoning that had initially been dismissed as childhood imagination. Her analytical capabilities had contributed to patient care in ways that exceeded professional medical evaluation. Dr. Harrison approached Emma's position with an expression that mixed professional respect with personal acknowledgement of fundamental errors in judgment about civilian medical education and analytical capability development outside traditional institutional training. Ms. Rodriguez, Harrison said with authority that now carried respect rather than dismissal, "I owe you an apology for my initial assessment of your capabilities. Your diagnostic insights have contributed to patient care in genuinely exceptional ways." The acknowledgement from someone who had initially ridiculed her claimed abilities provided closure that validated not just Emma's individual achievement, but her mother's systematic educational methods and dedication to developing analytical thinking through patient instruction and comprehensive medical education. Dr. Harrison, successful patient care results from collaborative thinking rather than individual expertise. Emma replied with mature appreciation. "My mother always taught me that medical excellence emerges through combining different perspectives and analytical approaches." As medical personnel continued implementing environmental modifications for both Marcus Thompson and Jessica Martinez, Emma's diagnostic insights were transforming treatment protocols and patient outcomes in ways that demonstrated the value of systematic reasoning regardless of its source or traditional credentials. Dr. Kim approached Emma with obvious professional interest in documenting analytical methods that had enabled breakthrough diagnostic reasoning under challenging clinical conditions and institutional skepticism about civilian medical capabilities. "Ms. Rodriguez," Kim said respectfully, "your systematic approach to environmental sensitivity diagnosis could benefit other pediatric cases significantly. Would you be interested in consulting on similar complex presentations that might benefit?" From your analytical perspective, the invitation represented recognition that exceeded Emma's most optimistic expectations when she first requested access to hospital educational observations to maintain medical knowledge during her mother's deployment overseas with humanitarian medical organizations. "Dr. Kim, I would be honored to contribute to patient care through analytical consultation," Emma replied with professional maturity that reflected her mother's influence and systematic medical education. "My goal is always supporting excellent patient outcomes through whatever analytical contributions might prove beneficial." The afternoon sun began its descent toward the western mountains as Emma Rodriguez had transformed from a dismissed child with a notebook into a formally recognized contributor whose analytical capabilities would influence pediatric diagnostic protocols while honoring her family's tradition of medical excellence. Over the following weeks, Emma's environmental sensitivity diagnostic approach proved successful in treating 6 additional pediatric patients whose conditions had puzzled conventional medical evaluation. Her systematic reasoning had identified common trigger patterns that environmental control eliminated more effectively than pharmaceutical interventions. Marcus Thompson recovered completely after environmental modifications eliminated his chemical sensitivity triggers. Jessica Martinez experienced similar improvement through systematic removal of synthetic compounds from her living environment. Both cases demonstrated the practical value of Emma's analytical approach to complex pediatric conditions. The hospital administration formally recognized Emma's contributions through establishment of an environmental medicine consultation program that combined her systematic analytical methods with professional medical oversight. Her diagnostic insights had created new treatment protocols that improved patient outcomes significantly. Dr. Harrison's initial skepticism had been replaced by professional collaboration that honored Emma's analytical capabilities while maintaining appropriate medical supervision and ethical standards. Their partnership demonstrated that exceptional diagnostic reasoning could emerge from unexpected sources and achieve results that challenged institutional assumptions. The compact notebook that had initially drawn laughter and dismissive comments now represented proof that systematic medical education could produce analytical capabilities that exceeded traditional training limitations, demonstrating that diagnostic excellence transcended age, formal credentials, and conventional expectations about medical reasoning development. Emma's success validated Dr. Carmen Rodriguez's educational philosophy that systematic thinking and comprehensive medical knowledge could be developed through dedicated instruction regardless of traditional institutional boundaries, creating analytical capabilities that contributed meaningfully to patient care and medical advancement. As Emma continued her medical education through hospital consultation work while maintaining her regular academic studies, her diagnostic achievements inspired other medical families to pursue comprehensive educational approaches that developed analytical reasoning alongside traditional academic subjects. The environmental sensitivity syndrome that Emma identified became the subject of medical research that validated her diagnostic insights. Through systematic clinical studies and treatment protocol development, her analytical contributions had created lasting improvements in pediatric environmental medicine that would benefit future patients. Dr. Harrison's laughter had been replaced by a professional partnership that recognized Emma's analytical capabilities as valuable contributions to patient care and medical education, demonstrating that diagnostic excellence could emerge from systematic reasoning regardless of its source or traditional professional credentials. The story of Emma Rodriguez proved that exceptional medical reasoning transcended conventional boundaries and achieved patient care improvements through systematic analysis, environmental awareness, and comprehensive diagnostic thinking that challenged institutional assumptions about medical capability, development, and professional expertise recognition. Years later, as Emma pursued formal medical education toward becoming a pediatric environmental medicine specialist, her early diagnostic achievements at Memorial Hospital remained inspiration for medical educators who recognized that analytical excellence could emerge from systematic education and comprehensive thinking, regardless of traditional training limitations or institutional expectations about professional capability development.